1 in 10 people reading this right now is hearing a sound that doesn't exist. Not outside, not a car, not a neighbor, not the TV. Inside. A high-pitched whine. A low drone like electrical equipment in the walls. A ringing that doesn't stop when you press the pillow over your ears. And here's the number that should make your blood run cold. 90% of people who go to a doctor about this problem walk out with eardrops. Eardrops that will never work. Not because the doctor is incompetent, but because they're looking in exactly the wrong place. Your ears are fine. The problem is in your brain, and I'm going to prove that to you right now. Subscribe and hit like. We're working toward 1,000 subscribers, and I need your help to get there. What you're about to learn is being systematically withheld from you. The healthcare system profits when you keep coming back. It doesn't profit when you get better and stop coming. That's the reality. I'm Sam Waterling, and I've spent 15 years watching this exact mistake play out in real patients. Let me paint you a picture. It's evening. You're tired from work. You turn off the television, kill the lights, and all you want is to fall into bed and disappear into sleep. The house is quiet. The street is quiet. But the moment you close your eyes, someone inside your skull flips a switch. For some of you, it's a thin, piercing whine, like an old CRT television warming up. For others, a low, heavy hum, as if a transformer is running behind the wall. For others still, it sounds like crickets in a field or ocean surf, except it doesn't calm you down. It drives you insane. You roll to the other side. The sound doesn't move. You pull the blanket over your head. It gets louder because it's not coming from outside, it lives in you. And that's when the real enemy arrives. Panic. What if this is permanent? What if something ruptured? Am I losing my mind? Your heart speeds up. Your blood pressure spikes. Sleep is gone. I know many of you just recognized yourselves in that description. Strong men and women come into my clinic and cry. Not from pain, but from this sound. It grinds you down harder than any physical injury. It won't let you concentrate during the day and won't let you recover at night. In 15 years of practice, I've seen tens of thousands of patients with this exact complaint. And I'll tell you directly, the vast majority of them were treating the wrong thing in the wrong place. Put down the eardrops. Stop searching terrifying diagnoses online at 2 in the morning. Take a breath. What I'm about to say may change everything you think you know about this condition. The number one mistake made by 90% of patients, and unfortunately by many of my colleagues, is treating tinnitus as an ear disease. That's the medical term, tinnitus. It means ringing or noise in the ears with no external source. Doctors prescribe ear irrigation, ear insufflation, antibiotics, vasodilating drugs. The patient completes the course, spends the money, and the ringing stays. Or it goes quiet for a week and comes back stronger than before. Why does this keep happening? Because in the overwhelming majority of cases, your ears are completely healthy. The eardrum, the tiny bones inside the middle ear, the ear canal itself, they can be in perfect working order. Tinnitus is not an ear disease. It's an alarm signal. It's a symptom. It's your brain screaming for help. Let me explain the neuroscience in plain language. Imagine you're a sound engineer at a concert. You have a microphone, that's your ear, and you have speakers, that's your brain, processing the signal. When the microphone is working well, it picks up everything around it, sends a clean signal to the console, and you hear clear music. But now imagine the cable from the microphone gets pinched somewhere, or the microphone itself starts picking up a weaker signal because of age, inflammation, or disrupted blood flow. The signal becomes faint. What does the smart engineer, your brain, do? It doesn't say, fine, we'll just hear less. No, it cranks the volume knob all the way up, trying to pull that weak signal into the audible range. It amplifies the sensitivity of the auditory centers to their absolute maximum. And what happens when you crank the volume to maximum in a quiet room? You get background noise, hissing, humming, electrical static. That static is exactly what you hear at night. This is called a phantom sound. Your brain has not lost its mind. Quite the opposite. It's working too hard. It's trying to compensate for a lack of incoming information by generating its own signal. The same principle behind phantom pain. A person loses an arm but still feels it itching. Your auditory nerve is itching. But why does the signal become weak in the first place? Why does the brain decide to switch on this alarm? Here is where the critical trap lies. People think, It's ringing. That means the nerve is dying. I'm going deaf. Soon there will only be silence. That belief drives people into depression, and it is a myth. The real reasons your brain activates this protective mode number in the dozens. And the majority of them have nothing directly to do with your auditory system at all. I see this pattern constantly in the clinic. A patient comes in complaining of ringing. We run an audiogram, the hearing test that measures what frequencies you can detect. The result is normal, ideal for their age, but the ringing is still there. We dig deeper and find a problem in the neck, or in the jaw joint, or a straightforward deficiency of specific micronutrients, minerals, that leaves the nervous system in a state of chronic overexcitation. Your brain is an extraordinarily energy-hungry organ. If it isn't getting enough fuel, meaning blood, oxygen, glucose, or if venous drainage is impaired and waste-filled blood is pooling, the brain starts to panic. And tinnitus is partly the sound of turbulent blood flow through narrowed vessels, which your overexcited brain amplifies tenfold. You are not hearing the street outside. You are hearing the machinery of your own body, the same machinery that a healthy brain silently filters out. A healthy brain has a powerful internal filter. It says, heartbeat, irrelevant. Sound of breathing, irrelevant. Joints creaking, ignore. But when the nervous system is exhausted by chronic stress, sleep deprivation, or pain, that filter breaks down. And suddenly, you're left alone with the entire internal orchestra of your own body. That is exactly why taking pills for your ears is like putting a piece of tape over the flashing check engine light on your car's dashboard. You might cover the light, but the engine isn't going to run better because of it. I want you to understand one thing right now. Tinnitus is reversible. If we can identify where the cable is pinched or where the filter broke down, we can restore the original settings. The silence can return. But to do that, we need to properly classify what's going on. Right now, I'm going to walk you through the 4 types of tinnitus. And pay close attention. Only one of them is genuinely dangerous and may require complex intervention, including surgery. If you recognize yourself in the other 3 types, consider yourself fortunate. We're going to address this without a scalpel, without a hospital, using your own hands in your own home. Let's become detectives. To defeat an enemy, you need to know its face. The noise sounds different for everyone, and your job is to listen carefully and understand which of the 4 categories fits you. This matters critically because the treatment that works for type 1 is completely useless for type 3. Type 1, vascular or pulsatile tinnitus. This is the most mechanical variety. Patients describe it this way. Doctor, I can hear my heartbeat inside my ear. This sound pulses in rhythm with your pulse. Your heart speeds up, the noise speeds up. You calm down, it slows down. Sometimes it sounds like a whooshing. Swish, swish, swish. What is happening? This is the sound of turbulence. Under normal conditions, blood flows through vessels quietly, like a wide, calm river. But if the channel narrows somewhere, from an atherosclerotic plaque, or far more commonly from a muscular spasm in the neck that has compressed the vessel, the blood begins to swirl and beat against the walls. And you hear that beating because the carotid and vertebral arteries pass within literal millimeters of your auditory apparatus. If you are hearing your pulse, it's the vessels. Full stop. Type 2, muscular tinnitus. These sounds are highly specific. Clicking, crackling that resembles popping bubbles, or an extremely rapid tapping, similar to fluttering wings or a distant machine gun. This noise is not constant. It can appear during swallowing, during yawning, or spontaneously. What causes it? Inside your ear, there are tiny muscles. The smallest muscle in the entire human body is the stapedius, the muscle attached to one of the 3 tiny bones inside your ear, and the tensor tympani, the muscle that tightens the eardrum. When you are under chronic stress, when you are deficient in magnesium, or when there is an issue with the facial nerve, these muscles begin to twitch. This is a tic. Just like an eyelid twitches, a muscle inside your ear can twitch. You can see the eyelid twitching in a mirror. You hear the ear muscle twitching as clicking or crackling. Type 3, sensorineural or subjective tinnitus. This is the most frequent visitor to my clinic. This is the classic monotone, high-frequency whine, ringing, whistling, like a television left on or an ultrasonic alarm. It doesn't pulse, it doesn't click, it just buzzes on one note. sometimes quieter, sometimes louder. This is phantom sound, damage to the hair cells of the cochlea, which is the spiral-shaped inner ear structure responsible for converting sound vibrations into nerve signals, or overexcitation of the auditory cortex of the brain. It is an electrical signal, a software malfunction, not a hardware failure. This type is most often confused with vascular tinnitus and treated incorrectly, with patients receiving IV drips of medications that do nothing to address the real problem. Type 4, psychogenic tinnitus. This is the trickiest one. Patients say, sometimes it rings, sometimes it hums, sometimes it sounds like distant voices or music. The sound changes with my emotions. You got stressed, it started droning. You got absorbed in an interesting film, silence. Here the problem is not in the ear and not in the vessels, but in the limbic system of the brain, the part responsible for emotional processing. The brain is locked in a state of chronic anxiety and interprets every bodily signal as a threat. Now that you have a rough idea of your type, I have an obligation to address the red flags. I am a physician, and my first rule is do no harm. There are situations where you should not be doing exercises and self-care. You should be at an MRI scanner. Listen carefully. You need to seek immediate evaluation if your tinnitus is strictly one-sided. If only your right ear rings while the left is completely silent, or vice versa, that is a reason to have your auditory nerve examined for growths called neuromas. Don't panic prematurely. This is rare, but it must be checked. The second red flag, tinnitus accompanied by severe vertigo. Not a slight feeling of imbalance, I mean the room spinning around you with nausea. Third flag, sudden hearing loss. You heard normally yesterday, you woke up today and the ear is muffled and ringing. This is acute sensorineural hearing loss, the medical term for sudden damage to the inner ear's ability to function. Time matters here. You have a window of 3 to 5 days to save your hearing with corticosteroid therapy. Go to an ear, nose, and throat specialist immediately. Fourth flag, neurological symptoms. If along with the ringing your face droops, your vision doubles, or your speech becomes slurred, call emergency services. Now, no delay. If none of that applies to you, if the sound is bilateral or inside the middle of your head, if it has been with you for a while, if there is no significant vertigo, breathe out. We have ruled out the serious possibilities. Your life is not at risk. But here's the question I hear constantly. Doctor, I figured out I have vascular or sensorineural tinnitus. I went to a doctor. They gave me IV infusions of vinpocetine, Mexidol, vitamins. I took betahistine for 3 months. Zero effect. Why doesn't anything work? Let's use logic. Imagine a garden hose with someone's foot standing on it. Water trickles through in a thin stream and the hose vibrates under the pressure. What IV medications try to do is make the water thinner. They improve blood flow properties, reduce viscosity. That's not without value, but does it lift the foot off the hose? No. Until you mechanically remove the pressure, no chemistry will help. If the vertebral artery is compressed by a spasm neck muscle, if venous drainage is blocked by years of slouching, the medication simply cannot reach its target in the necessary volume. You are treating the consequence while completely ignoring the gross mechanical cause. The ear is an organ that depends enormously on biomechanics, on the position of your head, the state of your jaw, the tension in your neck. And here I want to tell you about one patient. Andrew, 45 years old, a long-haul truck driver. A tough man, the kind who repairs engines on a highway in below freezing temperatures and runs on 3 hours of sleep. But the day he walked into my office, he looked completely crushed. He placed a bag of medications on my desk. Everything was in there. Vasodilators, nootropics, drugs that are supposed to support brain function, antidepressants, B vitamins in doses large enough for an elephant. Doctor, he said quietly, I can't do this anymore. During the day I manage. The sound of the engine covers it up. But when I stop for the night and the cab goes quiet, it starts. A whistle like a kettle about to boil inside my skull. I haven't slept properly in 3 months. My wife says I've become aggressive. My dispatcher is threatening to let me go because I'm losing focus. The neurologist at his local clinic had told him, what do you expect, Andrew? Cervical osteochondrosis. That's degenerative disc disease in the neck. Age-related changes, worn vessels, learn to live with it. Learn to live with it. Those are the most devastating words a tinnitus patient can hear. How do you learn to live with a siren running inside your head, around the clock, every day? Andrew brought me a stack of imaging reports as thick as a novel. MRI of the neck, MRI of the brain, audiograms. Everywhere the same conclusion. Age-related changes, vascular insufficiency. Come to terms with it. At 45 years old, I looked at his scans. Then I looked at him, and I asked him to do one simple, seemingly ridiculous thing. Not with his head, not with his neck, but specifically with his jaw. And you know what happened? His eyes went wide. The sound changed tone instantly. The thin whine became a dull drone, and then, for a moment, vanished completely. In that moment, we identified the true cause of his suffering, the one that not a single MRI had found. Let me explain the mechanism. Andrew sits behind a wheel for 10 to 12 hours a day. Head pushed slightly forward, hands on the wheel, shoulders tensed, teeth clenched from concentration on the road. This is forward head posture syndrome, and it doesn't only affect truck drivers. It affects every office worker, every programmer, every accountant, anyone watching this right now who sits with their head over a screen. Inside your cervical spine, your neck vertebrae, run the vertebral arteries. These are the main blood supply lines for the posterior parts of the brain, including the centers of hearing and balance. When Andrew sat with his neck extended forward, his vertebrae shifted and began compressing these arteries. The neck muscles turned to stone from sustained static tension and became a vice. Blood could not flow freely. It forced its way through the compressed segment with turbulence. That turbulence is the sound of your own blood hammering against vessel walls next to your auditory nerve. But that is only half the problem. There is a second cause that almost no one talks about. I call it the neighbor effect. The temporomandibular joint, TMJ, the hinge that lets you chew, and the middle ear are neighbors sharing a wall. The bone between them is sometimes no thicker than a sheet of paper. Beyond that, they share nerve supply. The nerves controlling the chewing muscles and the nerves going to the muscles inside the ear are deeply intertwined. Andrew admitted that he clenches his jaw while driving. Stress, a difficult road, someone cuts him off, the jaw locks automatically. This is bruxism, unconscious teeth clenching. When the jaw muscles, especially the deep pterygoid muscles, go into spasm, they compress the eustachian tube and exert mechanical pressure on the eardrum. The brain receives a distorted signal. Imagine your neighbor starts drilling through the shared wall. You can't see the drill, but you can hear it. That's exactly what the auditory nerve does. It hears the tension in the jaw and neck muscles and interprets it as a high-frequency whine. This is called somatosensory tinnitus. Tinnitus driven by the body's muscles and joints, not by damage to the ear itself. We did not prescribe Andrew another round of IV drips. We did something he never expected. We started working with his neck and his jaw. I showed him how to release the deep muscles beneath the base of his skull and how to reduce spasm in the chewing musculature. After the very first session, when we mechanically lifted the foot off the hose and restored blood flow, the sound changed. It became quieter, duller, lost its sharp edge. Within 2 weeks, Andrew slept through the night without sleeping pills for the first time in 6 months. We addressed the cause, not the symptom. We gave the brain proper nourishment, and it no longer needed to compensate by manufacturing phantom sounds. But how do you know whether your own tinnitus is coming from the neck or the jaw? An MRI won't tell you. A muscle in spasm doesn't light up red on a scan. Right now, I'm going to run a quick 3-step test with you. It will take exactly 1 minute. And remember the golden rule. Tinnitus that changes with movement is good tinnitus. Why? Because if you turn your head and the ringing shifts, louder or quieter, it means your auditory nerve is alive. It's simply being confused by signals from your muscles and vertebrae. This is called somatic modulation, and it is treatable. What's concerning is when you could stand on your head and the sound remains perfectly flat and unchanging, like a dial tone. Do everything slowly and gently. If you feel pain, stop. Test 1, the neck and vertebral artery syndrome. Sit up straight. Drop your shoulders. Slowly turn your head to the right as far as it will comfortably go. Place your right hand against your cheek and gently, very carefully, press your head against your hand, creating resistance. Your neck muscles contract. Now listen to the noise. Repeat to the left. Turn, press cheek to palm, engage the neck muscles. Then, if you have no dizziness, tilt your head back and look at the ceiling. Then slowly bring your chin down toward your chest, stretching the back of the neck. What happened to the sound? For many of you, at the point of maximum rotation or flexion, the ringing sharply intensified or shifted in tone. If so, congratulations. Your tinnitus has a cervical or neck-based origin. You just mechanically compressed already spasmed muscles, blood flow accelerated, and the microphone in your